Leprosy is always called the ancient disease. It's a disease which is known almost universally. It's a bacterial disease caused by a Mycobacterium leprae, and it is transmitted probably from person to person directly, but we don't fully understand the exact mode of transmission. These years, the last about 10 years, every year we had about 200,000 new cases of leprosy identified in about 100 different countries. So it's very widely distributed. The main burden is concentrated in only a few of these countries. It's India, first of all, but then also Brazil and Indonesia and a couple other countries. The disease spreads from one person to the other, mainly within the household of an infected so-called index patient. Other groups at risk are the social contacts who have very long, close contact with that index patient. For example, people on the same workplace, in the same school class. Then, of course, neighbors who spend a lot of time with that index patient. So it is a question of physical distance and time spent with the infected patient. But then also we have a group of people who are infected, but we don't know the origin of that infection. In the south of the US, there is a focus of animal transmission where armadillos are infected naturally and transmit the infection to people hunting, for example, these armadillos. The bacteria, they are intracellular and they mainly are found in the nerves. They lead to nerve enlargement and to the loss of sensation on the skin, which are served by these nerves. So you lose sensation, and there is a progressive growth of that area, which loses sensation, which results in secondary infections. Wounds don't heal well anymore, and this results in tissue damage, ultimately. Today we have effective combination therapy with 3 different antibiotics, which are taken either 6 or 12 months. And this very rapidly reduces to close to zero the risk to transmit the disease to other people, but over time also eliminates the bacteria from the body so that the disease doesn't progress anymore. The treatment itself has few side effects. The treatment is safe and well tolerated. The problem is more the long duration of the treatment, that people have to go every month to the health center to get the new treatment blister. And this is, of course, associated with time. It's perhaps travel expenses. So the people often give up after a couple of months when they feel they have completed the necessary treatment. Leprosy is not easily spread from person to person. It requires very long, very close contact with infected, untreated patients. So the risk is basically negligible for travelers. And then we also have to say that about 90% of the people have a protective immune response to the bacteria, so they don't develop the disease even if they are exposed to very high doses of these bacteria. Thus, the risk is very small. There are cases of infection, for example, in healthcare workers who are very closely working with untreated patients, but these are relatively rare. There are lots of challenges related to leprosy because leprosy is a disease we don't fully understand. We don't fully understand the transmission, and diagnosis mainly relies on clinical symptoms. There are no reliable biochemical tests to diagnose the disease. And of course, the effects of the disease are mainly irreversible. So the nerve damage, the tissue damage is not easily treated. We cannot predict the course of the disease, who develops very strong reaction to leprosy, who develops strong nerve or tissue damage. So in different areas, there's many challenges. Also, we don't have a vaccine. This is one area of research today, to develop a protective vaccine. And another area is to develop a protective treatment, post-exposure prophylaxis, which would protect people not from the exposure, but from developing the disease. We have currently the recommended treatment regimen by WHO, 3 antibiotics combination therapy, multi-drug therapy, which includes dapsone, clofazimine, and rifampicin, which is taken either for 6 or for 12 months, depending on the classification of the disease as multi or paucibacillary leprosy. This combination has to be, some drugs have to be taken every day and others have to be taken once a month. So it comes in blister packages, which are, by the way, provided for free for all people diagnosed with leprosy. The advantage is very clearly that it is a standardized treatment, very easy to deploy, and only 2 different regimens for multibacillary and paucibacillary disease, and then 2 different for adults and for children, but otherwise really standardized. The issue is a bit the long treatment duration. This results in a number of patients abandoning treatment after a couple of months due to different reasons. Leprosy is not the focus of many research groups. It is a difficult disease to study because it is impossible today to grow the bacteria in the lab. We have only very cumbersome animal models. The only model which is available is armadillo model. But armadillos, again, don't propagate in the lab. They are all wild-caught armadillos. This makes it really difficult to do basic research with leprosy bacteria. On the other side, there are many groups working on research projects in the area of prevention of morbidity, developing drug regimens to treat contacts, for example, of leprosy patients. There is some research in the area of vaccine development, where we have some progress. We don't have yet a vaccine which is ready for the market, but in various stages of development we have candidates. And then there is a lot of research more in the social domain, the rehabilitation and the elimination of stigma related to leprosy. Leprosy is often seen as a kind of punishment for sins done in a previous life or earlier in the current life, as a bad karma, bad luck. People affected by leprosy are often excluded from society and have thus very difficult living conditions. They have difficulties to find partners, to find employment. Often they are excluded from the social activities in villages, in the community where they live, but also from their families. Often they need to live in separate areas. So it is really a disease associated with many negative social consequences for people affected by them. Leprosy as a disease is well known, so in a way it is attractive, but the difficulties to do proper research with it because of the absence of good lab models and also, of course, a very limited market for application is a disease which is often researched in the frame more of ancillary projects related to TB, for example. TB, also being a mycobacterium, shares some similarities. So it is mainly groups working on TB or Buruli ulcer who also have interest in leprosy. Research in leprosy is mainly motivated by compassion for the people affected by the disease. A part of the research is motivated by the fascination with a disease about which there is still so many unknown, unanswered questions. These are perhaps not the typical motivations for research, but together they form a actually quite interesting mix, which results in interesting research projects. So there is research going on, and there is also a strong dedication in some quarters to this type of research.